Welcome to the Moulding Health Show. Our goal is to leverage the wisdom and experience of healthcare practitioners to set you on a path of self-discovery and healing. These insights, coupled with a multidisciplinary approach to each area of interest, should provide an invaluable resource to everyone looking for a better approach to health. In this episode, we speak to Jessica Dent, an occupational therapist, about hand therapy from an occupational therapist point of view. Jessica Dent, welcome to the show. So we're really glad to have you on board. And we've been looking forward to this for a while because I think you were telling us that you don't actually work with children and you're an OT. And I think most of the practitioners we've had on board have been working with children. So welcome. Thanks for doing this.
Thank you so much for having me. Yeah, I'm also really excited. I think it's an amazing opportunity. I think you guys are doing amazing things. So yeah, very good, very keen.
Okay, thank you. And yeah, thanks for saying that. But tell us, so your area of interest that we're talking about is hand therapy. And you mentioned, you don't work with children. So maybe take us into that. I mean, what got you interested in that type of area of interest? And was it a natural progression of being an OT? Or is it something that kind of spurred on the thinking?
Yeah, so I'm an occupational therapist who then has a special interest in hand therapy. So I've done postgraduate training. I've done a diploma in hand therapy after my occupational therapy degree. And yeah, I've always had I guess you could call it a bit of a weird interest in hands ever since I was little. They've always just quite fascinated me, and I think they're really intricate and awesome. So, but yeah, growing up, I had absolutely no clue what I was going to do. And then somehow got into occupational therapy and then immediately just went towards hands. I think I've known that I didn't want to work with the kids. Nothing against children, I love them, but I don't want to spend my whole day working with them. Whereas if a child has a hand injury, I'm there totally. But yeah, so we look at all hand injuries, upper limb injuries. So it's not just the hand, from the shoulder down to the hand and everything in between.
Okay, that sounds really amazing, hey? I mean, we had a podiatrist on like a few episodes ago, and he was just talking about, and I told him the same thing. It's almost like you spend most of your time, hands and feet, you're walking around, and it's actually so interesting that you mentioned that as well, because you don't get someone that just specializes in the hands like podiatrists, right? Is it?
No, not really. So you'll get, obviously your hand surgeons, doctor-wise, but then you would have your hand therapists, occupational therapists and physiotherapists. Yeah.
Okay, that sounds really cool. I mean, I'm glad. Yeah, because I didn't come across anyone, but you never know, because like with the healthcare professionals, sure, you get some real specialists. That normally you can't even pronounce the profession that's that specialized. But
for sure.
I'm glad there's no one like that. But I remember, and I think Shaz, it was a few years ago. Hey, we went for some. Because you have a special, like a private practice group for hand therapists, is that correct? Because we went for something in Bryanston, I think it was, and we did our little sponsorship thing. But I remember it was quite a nicely attended group. So there's obviously quite a few hand therapists. Is that correct?
Yes. So I think what you're talking about is SASH, the South African Society for Hand Therapists.
That should be right.
So yeah, and they're fantastic. They run courses and everything. So there is quite a large group of people with the interest in hand therapy. So then it's quite nice to have the courses run that are more targeted to us specifically and exactly what it is that we work with.
Yeah, it definitely makes sense because, OT is such a broad spectrum that being able to have a board or something that's specifically dedicated to the area that you work with. So, Jessica, you said, hand therapy is from the hands all the way up to the shoulders. But, what does hand therapy actually include? You mentioned injuries to the hands, but when would somebody come to see an OT regarding hand therapy?
So we deal with the rehabilitation of the upper limb and the hand. So most commonly after injury or with any sort of condition that has developed. So for example, fractures, tendon injuries, nerve injuries, repetitive strain injuries. So like a tennis elbow, or we see carpal tunnel a lot of scar management. So surgical scars or burn scars or something like that. We see arthritis patients, sprains, strains like soft tissue injuries, amputations we work with as well. And, any sort of injury or condition that means your hand or arm is not working the way it should or used to, and it's really impacting how you are able to function or perform your everyday activities. So then that's kind of how it comes into the occupational therapy point of view as well. Because if you think of your hand in how we use our hands every day, if you can try and just think, if you didn't have that hand, even your non-dominant side, how it would affect you and your independence and what we tend to take for granted, I think, each day. So yeah, really a huge range of things that we treat post-surgically as well as conservatively as well. So a lot of the times I think our patients and a lot of the doctors don't realize what we can do to prevent the need for surgery as well.
Okay, that actually sounds really interesting. I mean, I did this as an exercise, but every so often, like if you think, you don't have a thumb, I mean, like how difficult would that be, So what you're saying makes complete sense. I mean, you almost like take it for granted how amazing it is. But, if you didn't have one of the fingers or something, would be quite a challenge. I remember I was in standard 6, well, we call them standards, but now grade 8. And a friend of mine, he came off the skateboard, but it was one of the few things I saw, but he, fractured both his hands. And I mean, I couldn't even imagine it. I didn't even know you could do that. But, for 2 months, it was horrendous for him. I mean, he couldn't do anything, which was quite interesting. So yeah, I get your point. My brother as well. I mean, he was playing action cricket and his little finger, it's actually fused now. You can't really even straighten it. And I know from him, I think he went for, OT, but eventually he needed like surgery, to straighten the bone, for that. But he was saying how difficult that process is as well. It's not, it's not a trivial thing. And I think even now he doesn't have full mobility. Sorry.
And most people would say, oh, it's just your little finger. Or someone is saying, things are really hard since this injury. And they're like, talking about, man, it's just your little finger, it can't be that bad. Until you are the one who has injured yourself, it's a completely different story. And shame, I think sometimes our patients come in and they're like, it's really, I see other people's injuries and theirs look so much worse. Mine, I shouldn't be complaining. And what I often say to them is that, it's all relative at the end of the day. What may look like a small injury to someone else can be affecting you massively in your everyday life. So, I think we can be quite quick to judge, that's not such a big injury. But at the end of the day, it affects you big time.
Okay. Yeah, I mean, I get it completely. I think even with me, I struggled with like carpal tunnel for a bit because, obviously being in front of the computer a lot. But it kind of went away. And I think I found maybe getting older as well, you find better ways of managing it. So you can't sit for 8 hours at a stint, you have to take breaks and all of those things. And that kind of seemed to have helped because I haven't, found it for a while. But coming back to your clients, I mean, so how would they normally find you? I mean, do you have like referrals from, the surgeons or would someone just go and Google, I need a hand therapist? How does that work?
So we get a bit of both, but our referral basis is definitely our biggest way that our patients do find us, because often people aren't aware that we even exist or what it is that we do. So they wouldn't necessarily think, I must go see the occupational therapist for my hand injury. We do still, from our doctors and from our patients, get called physiotherapists on a daily basis. So
I'm sure you love that.
The difference. Oh yeah, it's my favorite.
Yeah.
Trying to teach them the difference. But so our major referral basis does come from surgeons, GPs, or other healthcare practitioners who know what we do and know how we can help the patients. But then we do get quite a few who maybe have heard about hand therapy or heard about occupational therapy and have Googled hand therapist near me. And then we come up and then they kind of come not quite knowing what to expect from us. And then the whole story starts from there.
Okay, that's amazing that you mentioned that, and I think that's the reason we're doing, this type of show, with the Moulding Health show, is that if anyone was even thinking about this, and because that's what I find with Google is, Google scares you crazy sometimes, because you go there and you search for something, and they always give you like the worst case scenario, and or so someone wrote some article, and it scares the hell out of you. But I'm hoping that if someone was thinking, okay, probably have an issue with my hand, and they hear this interview, it's like, okay, cool, let me give Jessica a call, and just see what, how would she help? And maybe even after this, they get a good sense of how you work with clients. And so maybe take us through that. So if someone, you got the referral, or they, made the first phone call, how would it work from there onwards?
So they would need to come in for their first session, where we would go through the assessment process. So we do quite a comprehensive assessment. Obviously, what is the complaint or the injury or the issue? What could possibly be causing it? Are there any other tests or anything that have been done? Or do we have a referral from a doctor telling us what the problem is? But then as occupational therapists, we do quite a comprehensive assessment. So we're looking at pain, swelling, their sensation and how they're feeling, movement, how they are able to function, and obviously then working together with our patient to find what is the therapist's goals, but most importantly, what is the patient's goals? What are they looking to get out of therapy? What do they want to achieve from it? And then from there, starting the treatment process. So obviously, certain things need to come before others. So looking at getting pain down, sensitivity down, swelling down, and starting to work on any scars that are there, getting the movement going. My biggest thing that I find is teaching or just chatting to the patient about what their expectations are and what they can expect from the therapy process too. I think often the expectations aren't quite realistic, and then hopes can be let up just for how soon things may be dealt with or looked at in treatment. So, and getting them to understand their injury, because what I find a lot is that maybe doctors don't quite take the time to explain to the patients what it is that the injury is, or what even has happened in surgery. It's a bit frightening if I can ask my patients, what surgery did you have? And they're like, I don't know. And I'm like, oh, you don't know what surgery you just had? That seems a bit crazy, but it happens so often. So explaining to them as well, just the structures of the hand and how they work in obviously quite a nice layman's way, where if they have an understanding of why they're feeling what they're feeling, and what we need to do to make it better, they're a lot more compliant and they're a lot more willing and engaging in therapy. And I find that our results are then a lot better at the end of the day. But yeah, so we use a lot of functional activity in our therapy. So obviously it's all about hand function. So finding ways to get the grip, get the grasp, get the pinch, targeted exercises that are going to really improve certain movements, improve certain muscle groups, that we know will then help them to get those functional movements and get them using their hand better. We help with the process of often returning to work, because usually after an injury like that, there would be a period where they're not able to do their job. And even looking at certain adaptations or compensations, either on a temporary or permanent basis. So during the recovery, how are they able to get the things that they need to get done while they're still recovering and don't have their full hand function? If we're not expecting their function to return fully, what permanent things do we need to put in place to make sure that they are functional human beings at the end of the day, and that they're able to still earn their income, look after their families, and look after themselves as well. And then the last thing, which is really important, is we focus a lot on exercises for them to do at home. So, typically my patients will come on a weekly basis. For quite bad injuries, we might see them twice a week. And we really try and encourage a daily exercise routine that will be changed and upgraded throughout the rehab period. But my measly 30 minutes to 60 minutes once a week is not going to perform miracles on their hand. So getting that buy-in from the patient and getting them to actually do their exercises at home, it's a huge part of whether they'll be successful in their recovery or not.
I love the way that you phrased that, Jessica, that it's a two-way street. Firstly, let's make sure that everybody's hopes, goals, and expectations are on a level where we know this is what we're aiming for, instead of, well, you're going to reach the moon. But more importantly, that concept of actually you have to do homework at home. As a kid, my best friend's little brother, it was the most amazing thing. We were all gamers, and I could never understand how this kid could outplay us in a game. He was actually born with no bottom part of his arm, but he had these 3 little nubs. Man, and that elbow and the way this, and what you were saying earlier about if you don't realize you're missing it, you carry on.
Yeah.
But I've tried it. I can't play TV games with my elbow. I don't care. But I mean, Kyle would wipe all of us off the floor. And then obviously as he got older, now he has to start looking at, his parents had to start looking at, this kid's going to finish school and going to need it. So that's where OT kind of came in to, how does he now function in a office job with one hand kind of case.
Yeah.
So, and that whole thing of compensating tools, if the injury is never going to be corrected, how do you still, like you say, grasp, grab, pinch? I just always found it amazing that OT could teach him how to work on a computer with one hand. I was like, how do you type with one hand? But
no, look, and sure, those children that have the congenital deformities and are born in a different way, they blow my mind, honestly. It is amazing. And I think it is, it's what they've always had. And if you think, when we're babies, we can't just be grasping and manipulating everything, and we're not writing immediately. So we learn to work with what we have. And my patients always laugh at me a lot of the time. The activities that we use are very basic, and they always say, oh, you're taking me back to primary school now in the type of things that we're doing with their hands. And I say, well, you kind of have to learn to do it all again, because you lost it, and it's not just magically going to come back one day. So there's a reason why we did these things in primary school. We're going to be doing them again now.
That makes a lot of sense. When you were talking earlier, though, I just took down some notes, and I was saying, so does this go anywhere close to the medical legal stuff as well? Is it, do you, or maybe in a different way? I mean, when a patient comes through, and for instance, if they can't get better, you said something about realistic goals. Do you have to get concessions at work, or is it something related to the injury that, maybe they can't do their job in the same way, but they can do it in a different way? Do you find anything like that with your patients?
Definitely. So expectations from an employer can be quite tough to deal with as well. And we do play a big role in that. So especially with us, we see a lot of patients who are injured on duty. So they obtain their injuries at the workplace. We see a lot of metal workers, industrial workers. So, but even if it's not an injury on duty, getting back to work can be quite a tough thing, especially if we are looking at the patient not regaining the same function that they had before. So it can kind of go two ways. Sometimes, even though their hand or arm will never be the same, they're still able to perform the job that they were performing before. by compensating or doing it just in a slightly different way. And a lot of the time, it's actually the employer or people at work that are very nervous. They're the ones who are nervous. They think, oh my gosh, he'll never be able to do this job again. We'll have to find a different job. And in that case, us actually going to their workplace, having the patient there, having the employer there, or their supervisors and all of that, and seeing for themselves, the patient and the employer, well, actually they can do it. And a lot of the time they're both really surprised. And it's one of my favorite things, is saying, you see, I know you thought you couldn't do it. Look at you, like, this is amazing. You never thought you would reach this point. Or it can go the other way, where there's absolutely no ways they would be able to do the job that they were doing before. But we then work together with the employers and with the companies to see, is there another reasonable accommodation that can be made? So something that the company is actually financially capable of doing, and something that the patient would still get satisfaction out of and enjoy doing, because a lot of the time the employer just says, oh, well, yeah, they'll do admin, and like stick them in an admin job, whereas they were a manual laborer. Like, do they have the skill? Do they have the interest? It's still their daily job at the end of the day. Do they have the physical capabilities for it? So we try and get them almost as close to what they were doing before, with certain maybe environmental changes or a slight change to a tool or the way that they would manipulate their environment and their tools to still be as productive as work needs them to be. Because we also can't expect the workplace to just kind of take a financial hit because the patient can't do what they used to do. It is a company at the end of the day. So it's about making everyone happy. The employer is happy because their staff member is capable of doing their job, they're productive, they're making money for the company. And the patient is happy because they're getting productivity and satisfaction out of a job that they enjoy doing and that they're physically actually capable of doing. So yeah, but then we do see a lot of patients where maybe it hasn't gone quite as smoothly as I just described. There can be a lot of hostility and tension in the workplace, and perhaps someone is unfairly dismissed, or there isn't something that the company can do for them. They can't reposition them. So medical legal and stuff like that then does also come into play. But myself particularly, I don't do the medical legal side, but hand injuries are very, very big on that side of things.
So just in that whole thing, if you reached a point where with a hand injury, this person is never going to be able to continue with their job and they have been unfairly, would you then refer them to an OT that deals with legal and workman's compensation?
So yeah, we do try and get to a point where we can make the best, make it work. But there have been situations where we can't, and then we most frequently would refer them to the CCMA, especially if there's been an unfair dismissal. If something's unfair, then we really try and encourage them and educate them about what their rights are, and following the right kind of steps to make sure that they are treated fairly, or that if they were unfairly dismissed, that appropriate compensation and stuff does come into play. For a lot of our patients injured on duty, they qualify. If they can't go back to work, they basically get a pension from the compensation fund. The difficulty is that it all sounds fantastic, that they'll get their money and they'll be compensated because they can't work anymore, but it doesn't quite run so smoothly with our Department of Labor. So we have patients who aren't able to work, they're not able to find another job, and it's 5 years, 6 years down the line, and they haven't received any money from the compensation fund. So that can be quite a tough thing to deal with, because we can also only do so much. So we can tell them all the forms that they need and we can send them to everyone that we know. But there does come a point where if someone along the line isn't quite doing their job, or there's a big backlog and things, then they do end up kind of sitting and waiting. So what we've seen now, which I'm quite hopeful for, but also a little bit don't want to get my hopes up, is the compensation fund have started what they're calling a vocational rehabilitation program, or retraining program. So trying to get patients who have suffered injuries at duty, who are pensioners now, they're on permanent disability, and trying to teach them new skills that they are capable of doing, so that hopefully they are able to get back into the workforce.
I like your perspective on it, because you gave like a very all-rounded, from the employer to the employee to some legal there as well, which is actually really cool. I mean, it shows your experience, obviously, with working in that field. But you're right. I mean, there's so many different sides to it. But I do feel, quite sad if someone, does go through that. I mean, it must be horrendous. I mean, we've had clients working with the road accident fund, and I know for some time, I mean, the road accident fund, we're not paying. I mean, the one client had like a booming practice, with the claims, but it just kind of went almost to a halt, and her practice took a huge dive, based on that. So it's the first time I'm hearing about the compensation fund, but if it's anywhere close to that, I can kind of, collaborate the story, because it sounded horrendous when it was happening.
Yeah, we went through. Sorry, go ahead.
Sorry, go for it. No, you go.
We went through a very similar thing with the compensation fund. In 2019, they changed their system, and for a full year, there just was no system at all. And now, it's slowly come up, but it's still not a very functional system at all. And it's how we are supposed to be getting paid for the patients that we see. And yeah, I mean, for a full year, we didn't get paid at all for our patients. And we still are fighting very hard to get a little trickle of something coming in. And the workman's compensation patients, they're about 80% of our patient load. So it's been hard. It's been a hard 2 years, the last 2 years. But, I think, me and my colleague, we were talking about it earlier. And we were saying, if we didn't love doing our job so much, I think we would have stopped a long time ago. I think the challenges financially wise, or remuneration, it's not always, but the patience and the love of the work that we do, I guess, keeps us going. So it makes it worth it. The day.
Yeah, I mean, tons of respect for that stuff. I mean, I don't think many businesses, would ever survive that stuff, but healthcare practitioners seem to do it with a smile, like you just did, which is interesting. I'm sure, I'm sure there's lots of tears around that stuff as well. But, it sounds horrendous. And I was just going to say, until you told me that, it's quite fortunate if you have like other work that you busy with, or other types of income coming in. But if 80% comes from the workman's compensation, that must be a real there must be a real I was going to say dent, but that would be a real that would be a real bummer, in terms of that stuff. But so I'm glad you guys could get through that, and hopefully it does get better, because I think that's it would be sad to lose that level of skill. And I think because that's the reality, is like if you don't earn the income from it, what would cause you to keep on doing it, unless you didn't have, like you said, the love of doing this and helping people. So I think, I'm sure your patients are very grateful for that, the fact that you still continue to help them, which is amazing. But coming to the patients, how long would they normally see you for? Is there a certain time period? Or does it depend? Obviously it depends, but is there an approximate time?
Yeah, so it can vary a lot. Obviously, depending on the injury, depending on the severity of the injury, depending on the patient's compliance. Do they actually come for therapy? Do they do their exercises at home? And yeah, so it really can range so far from 2 sessions to 2 years. you know. We have patients where they come once, they were freaking out about their first session, they were so scared. They came and then we did the therapy, and the very next session they say, I'm absolutely fine, I don't need therapy anymore, like go for it, living life happily, which is awesome. But then obviously we've got the very severe patients who we can expect to see, you know, I've seen patients for a full 2-year period from a few days after their injury to 2 years later, where we finally kind of got what we were looking for, not because the patient wasn't working hard, but because the injury was just really bad.
So just on that, so people come to OT for hand therapy and that kind of stuff based on injuries. Would there be any other practitioners involved in actually helping and treating that patient? Would you work as part of a multidisciplinary team, maybe with a physio or with the surgeon, the surgical staff, or would it solely be treated from an OT perspective moving forward?
So there definitely are instances where we work within the MDT. So for us with the hands, we've got a very close relationship with our surgeons. So we also need to know what they've done in surgery, exactly what they've repaired, how they repaired it, with what surgical techniques did they use, because that can also direct the therapy approach that we need to use with the patient. Most of our patients follow up with their surgeons on like a monthly, 2-monthly basis. And if we've got any issues, sometimes we need to refer the patient back for further surgery if we're not happy with something. So we work really closely with them. And then with physios as well, there are a lot of physios who take on hand injuries and also quite complex hand injuries. But I must say, an occupational therapist, when it comes to the hand itself, is really who you want to be seeing. We do a very comprehensive assessment and treatment, and we look at the patient holistically, like absolutely every single thing that's got to do with it. And, you know, outside of the physical aspects as well, we take that into consideration. But I have a lot of patients who perhaps have a very big hand injury and a very big shoulder injury as well. And I would say physios are more, their expertise lies more in the shoulder and further up. So we might say, okay, well, I'm working further down with the hand, and then we've got me concentrating on that area, the physio concentrating on maybe a back or a neck or a shoulder, which can have a huge impact on their hand function as well. So we work together with them quite a lot too. For amputation patients, we work with prosthetists who make the prosthetics. So knowing when to send the patient to them, we help in preparing their limb for the prosthetic. And then once they're fitted, we do the functional training with the prosthetic. So we're very lucky in our rooms, we've got a prosthetist here. So we've got a nice close relationship there too, yeah.
That's amazing. Yeah, I would have, yeah, that actually makes a lot of sense, eh? I mean, and I think having, you know, when she was asked that question, I thought it was a really cool question, because it's interesting to know, even anyone that's listening to this and, you know, thinking of setting up an appointment with you, is knowing, you know, who you're going to be working with, possibly based on the injury that they have. And I'm glad you said that stuff. Also, when it comes to, you know, the different types of therapists, you know, what you said, you almost like need to pick the right therapist for the injury that you do have, you know, and start going there. And maybe you do need some, you know, strengthening of the muscles or something, and then you need someone else. But it's quite nice like that. And I think for anyone that's looking for, because I think one of the therapists also said, you know, in South Africa, we almost like look for that magic pill. And sometimes it's not that. It's like multiple people that you need in order to be able to get some level of functionality. And so it's not just one person that's going to fix it. And I think that's something new. I know with our little boy, that was something I had to learn. You know, sometimes it's like, you know, multiple, you know, therapists that you need, you know, one to help with sensory, you know, one to help with core muscles, all of those kind of things, which I thought was quite cool. But I must tell you the story. So we were busy with a big project at MTN, and, you know, it involved robots. So, you know, like, you know, for the packing of stuff. And we created all of these safety cages. So, like when one of the operators went into the cage, the robots would stop. And we tried to convince the operators, actually, you don't want to go into the cage because the robot can't, it can't sense, and stop. But it used to freak us out, and the management team, whenever an operator decided he's going to go inside the fence, to go and get something, like a phone dropped or something. And we never saw an injury, but we were almost like bracing for, an injury every time something happens. So,
well, that's the thing. It gives you the heebie-jeebies. And I think for me, I've seen so many patients where things have gone wrong. And it's just that split second of a glove got hooked on this, or, wasn't quite concentrating, or I was busy cleaning the machine and someone else turned it on. And it's just like, whew. And then I see people in certain situations and I'm like, no, don't do that. And it's absolutely fine. But I think I'm so used to almost seeing what goes wrong instead of seeing it work the way that it should.
Yeah, no, it's crazy. I mean, so when you were telling me that and you're doing site visits and stuff together, I remember those things because we tried to put as many stickers, and to say, no, you can't do this. And, we tried to almost design the safety systems, so that, even if they tried to go anywhere near the fence, the systems would just break or cut off. But people find some weird ways to do this, hey? I mean, I remember the one, he found like a broom or something. So he could almost still get the boxes. And I'm like, that's still gonna hurt you. Like if the robot catches onto the broom and swings it or something. But yeah, it was interesting.
And they really are freak accidents that cause these things, hey? Like they're really, and I don't know what happened, and the next thing this happened, and next thing my arm was gone. Or it's insane. My stepdad it was his birthday this week as well, and he's a very big DIY, and we all came together and got him this fancy circular saw that he really was desperate for. And I just said to him, we went for dinner, and I said, you do understand that those circular saws are my main source of income. Like they bring the business to me because it's guys like you at home who are working with your circular saw or your angle grinder, and next thing you're seeing blood come from places that it shouldn't quite be coming from. And so I said to him, you better be careful that if he hurts himself, then he knows where to find me.
Oh, wow. That's cool. At least he knows. I mean, the other thing that used to freak me out was chainsaws. Fortunately, I didn't play too much with it. But I remember, we had some work to do, and then we went to buy one. And I remember the person at, the store we bought it from, showed it to the gardener, and he was saying, this stuff doesn't stop. So, if you holding it wrong, I mean, it just is going to rip that limb. So you have to be so careful with it. But yeah, it scared me.
No, it's funny. You guys are all talking about power tools. Do you remember years back, Verimark released this, it was called the Le Chef to julienne vegetables?
Oh my goodness.
My mother, a brand new Le Chef julienne in vegetables for stir fry. And the next thing my little sister says, Mom, why is there blood in the veggies? The blade was so sharp, it took half of the thumb off here. And also, again, now you've got this bleeding, and even then, because of the scarring, she did wind up having to go see an OT because she couldn't bend her thumb. And that was a kitchen implement to julienne veggies. So, it's not only the boys with their power tools, it's the girls with their kitchen gadgets.
100%. Shame. I had a lady the other day who was helping her daughter. She has a teenage daughter who smokes hubbly, and she was cleaning the base, and the glass cracked, and she sliced her tendon, and she had to go for surgery, and then had 8 weeks of OT after that. Like, she was like, my child will never smoke hubbly again.
Yeah, I suppose if you want to go down that route, there's so many things that could damage and kill you. It's just it's it's a little bit of luck with it as well. But I think if we knew most of these things, you probably don't want to walk out of the door because it's so hectic. But yeah, I love this. I mean, it was an amazing chat. Is there something that we missed that we should probably ask you around hand therapy, or how patients would look for an OT around hand therapy? Is there any question that kind of screams to mind?
So, not that I can think of, but just, I think often people don't know what it is that we do or what it is that we can offer. So I think what patients need to remember as well is that obviously doctors are going to refer them to people that they know, therapists that they know, but it is also the patient's choice at the end of the day. So don't forget to do your research on who your prospective therapist might be too. Obviously, it's also very easy for us to market ourselves. We can do this, we can do that. And, maybe word of mouth and stuff comes into play there as well. Other patients speaking from experience. But, we offer things like custom-made splinting, where we splint our patients to fit them 100%, not just a off-the-shelf brace that they may get from Discount. And often for them to understand that although in the beginning it may seem pricey, although our prices are nothing like the doctor's prices, but they're happy to pay those, but it makes their rehab period so much quicker and it's so much more effective. We measure and make custom fit pressure garments for scar management as well. So there's so many, it's hard because there's so many different injuries. There's so many different things that we can do for patients. So I guess at the end of the day, and that's why we're doing this whole thing, is to try and get people's understanding of what occupational therapy is and what hand therapy is, and that they also don't have to settle for someone yanking at their sore hand with the possibility of actually making it worse, because we've had experience in that before, where patients have spent a lot of money going to the wrong therapist who has made their hand worse at the end of the day, and they've still paid their money to make their hand worse. So for the patients to also realize that if they're not happy with the service, they're allowed to not be happy, and they're allowed to look elsewhere as well. I mean, if a patient wasn't happy with my service, I wouldn't want them to stick around and be upset with the outcome at the end of the day.
Yeah, well said. I mean, I think what you said about patients having the choice. I think if they knew differently, that's something we're trying to unveil. And I think also what you said about almost like the therapist having the best interest of the patients at heart. And I think sometimes patients don't really realize that. We see it a lot with with psychologists and stuff like that, where patients don't realize actually they can actually move to someone else, if they wanted to. And so what you're saying there, I would just reinforce and say, yes, you do want to, shop around sometimes and, just maybe consult. And I think also maybe a call to any therapist as well, and almost like find your niche, find your specialization. And sometimes it's always in the best interest of the patient. Well, not sometimes, always. It's in the best interest of the patient, to say, actually, this is as far as I can go. Let me try. Let another therapist, have a, try this, because actually, Jessica saw a lot more patients around hand therapy. I think that makes more sense. So I would definitely reinforce that. And I like the fact that you said that, because I think we forget that. And I think you're the first therapist that actually mentioned, the patient does have a choice and they should shop around. Yeah. And, my wife this weekend, we were talking about, and she called it old school therapist, but, I always think OTs always do this, but, as you said, you design a custom splint. You just don't go buy it from Discount. But she said exactly the same thing. It's like, it's almost like therapists now, and I don't know if she mentioned, maybe the newer therapists, maybe just recommend, just go buy something from Discount. But, and almost all OTs that I know just always create custom. I think that's part of your training and stuff like that.
Definitely.
Where you do.
And I think, we see the benefits of it as well, having that custom fit, where also we're able to remold it. We're able to adapt the splint according to how you are responding and what the patient themselves needs. Like, even if I've got 3 different patients injured the same way, injured exactly the same tendon, they've been to the same surgeon, but they can be completely different and need different things from me as their therapist. So I've had patients that are like, I couldn't afford coming for therapy, so I went and spent my money. You're still spending money going and getting the wrong thing and trying and being in pain for so much longer than necessary and spending your money on things that aren't working, and then coming back to us at the end of the day and saying, I should have been here to start. And I say, well, at least a lesson learned at the end of the day. It's a hard lesson. It's a really tough lesson to learn, but I guess it's how we all learn lessons at the end.
Yeah, no, definitely. And I think also from, you almost like need to find those specialists, that you would almost like never want to lose numbers from, and I think that's what it's about, because you try. I mean, like if you didn't know about hand therapy, I mean, how, you would go onto Google and try to find, the best fits. And, maybe the first entry was going to tell you, actually, you need to go down the physio route. And then you kind of go down that route. But it's, I think sometimes it's a learning experience as well. But and that's why, like Shez and I feel quite strongly about this, because I think there's lots of topics that I wish, I knew better, especially around parenting. But, if we knew that better, we would have made better choices. But, you do the best you can, and, knowledge is always power. And I think what's cool about this part is it's from a South African context as well. So, you're dealing with, someone wanted to make a booking with Jessica Dent, they can. It's not like it's, outside the realm of possibility, whereas, if we were, we had someone on the show from, Seattle, it's going to be pretty difficult maybe to get a booking or so. And
definitely.
Just on that, exactly what Jessica was saying about that custom-made splint, that custom-made fit. When we were speaking to the podiatrist, he was saying the same thing. You can go off to Discount and go and buy orthotic shoes, but if that insole's not right, it's not going to correct it could actually potentially make it worse. And more importantly, that from a South African perspective, I mean, you're seeing injuries that are happening in the workplace or in the South African context. They're going to be very different to injuries that are happening, let's say in Australia, where somebody gets their hand taken off by a great white shark. I mean, it's a completely different way of treating the injury. But at the end of the day, it's that custom-made splint, that custom-made prosthesis that's going to make that difference as well. And it might cost a little bit more now, but you're right. In the long run, it's actually going to reduce the amount of time that you're actually having to be in therapy for. And I think that's what people need to remember, is that sometimes it is an outlay now, but if you work it out, it's going to cost you a lot less in the long run. I think Lucas actually said it, if you're going to buy a pair of shoes, buy a good pair of shoes that's going to last you the next 5 years, and spend a little bit extra, as opposed to buying 10 pairs of 100 Rand shoes, because you're going to go through 2 pairs of shoes a year, and they're not going to give you the support that you need. I would say the same thing when it comes to your hands. You use them every day. You need to look after them.
And you only get one pair, your hands are your hands, and once they're gone, they're gone. And one of the biggest things, we get quite a few patients who say, okay, well, how long have you been struggling with this issue for? And they say, since the beginning of the year, or it's been about 6 months now. And we're like, well, why is this the first time? And they're just like, no, well, either a financial difficulty, or I thought it would go away by itself, or I try to go to the pharmacy and just get like self-medicate, and it's like, okay, well, now your therapy is actually going to take longer. The issue is much worse now because we've waited that long. And the biggest thing we tried with our doctors as well, is to say, please refer the patients as soon as possible, because most of the time they don't know about us, and they don't know that they will need to see us. And we need the surgeons to be telling them, look, this is going to be a big part of your recovery, and send them to us immediately. Because or they're like, oh, no, I'm sore, I can't come for therapy. And it's like, well, why are you coming for therapy? To get your pain to go away? Like, isn't that the whole point? So I can't come for therapy today, I'm too sore. Okay, well, come for therapy and we'll help to bring your pain down. Like, that's the whole thing. So, for patients and stuff to understand as well, They can come when they are at their worst pain. They can come when they've got stitches in. They can come when they've got wounds. Like, we work from day dot until the very end. And the more patients can understand what therapy is supposed to do for them and when they should start in order to make the recovery period as little as possible.
I like that. Yeah, the sad thing is, I mean, I think if the doctors, the surgeons actually told the patients, they would look, they would do it religiously, there wouldn't be even a question about it. They would just say, okay, cool, we need to go for OT. And it's like the same with kids and school teachers. We had a teacher on last week, and she said the same. We were just joking with her. We said, whenever the teachers say something, the kids listen. It's almost like that is it. So I think with patients as well, if the surgeons told them that, they would just do it. There wouldn't even be a question about it. So I think there is something.
Oh, and they do. They
that.
listen to their surgeons. Hey, they really do. They won't listen to a word I say as their OT, but sometimes I've had where I call the surgeon and I say, please, can you just reinforce this to the patient? Because they're not listening to me, but I know they'll listen to you.
Good strategy. I love that. I would definitely use that more. Shez, we want to close it up now. Is there anything on your side that we should have asked Jessica that we didn't?
No, I think we've actually covered, we covered hand therapy from a very broad, high level aspect. And I think there's a lot of information that potential patients can take away from this. So I think it's been a good conversation, and hopefully it just starts to get that conversation going with the general public who actually needs to look after their hands.
Cool. And then I think on our side, Jessica will definitely include all of your details in the show notes. And then so if anyone wants to reach out, they can give you a shout and or call and take it from there. But thanks very much for doing this. I think we've been looking forward to something that's more adult-based as well, because we had lots of, pediatric-related stuff. But yeah, I think we're starting to shift the conversation, and I'm really glad that we could get your time on it.
Well, thanks so much, guys. It's really been lovely. And like I say, I'm really chuffed. I've been listening to your guys' podcasts and really enjoying them. Even though I said I don't like working with kids, I really enjoyed listening to the pediatric OTs. So thank you so much for having me. I really appreciate it. And I think, any opportunity to get the word out there, and if people know the options that are available to them, then hopefully they'll use them. So thank you so much.
You're very welcome, and it was a blast from our side. And I know I joked about it, but we love those conversations as well. We learned tons from them, with the pediatric OTs.
Oh, thank you so much.
Cool. Bye. Hey everyone, thanks for listening. As always, stay tuned, and we'll speak to you in the next episode.